Hello, everyone, and welcome to The Wild Side of STEAM, where we explore the unusual careers in science, technology, engineering, art, and math at the Smithsonian's National Zoo. My name is Shelley. My pronouns are she, her, hers, and I'll be your host for today. I'm so thrilled today to be joined by Jessica Sosa, a licensed veterinary technician at the zoo. Hi, Sosa, and welcome.
Hi, Shelley. Thanks for having me.
Why don't you start by telling us how long you've worked at the zoo and what it is you do there?
Sure. So I have been working at the zoo for a little over 10 years now. My official title is Biological Sciences Laboratory Technician, and that's just a fancy way of saying licensed veterinary technician. um, and yeah, that's what I do.
That's really cool. So what exactly does a veterinary technician do?
To further understand what a veterinary technician does, I think I should just touch a little bit about the role of the veterinarian.
Great.
Veterinarians, their ultimate goal is to provide medical care for animals, and we share that goal. We work very closely as a team to provide that service. The veterinarian is the ultimate manager of the patient's care and formulating treatment plans and preventative measures and those type of things. The veterinary technician works closely with the vet to provide that support and assist in carrying out those treatment plans.
All right, very cool. So what does a normal day look like for you as a vet tech at the zoo?
Oh, there's never a normal day in medicine in general, but the National Zoo has a team of veterinary technicians that rotate through several different areas in the hospital. Um, we do keep some flexibility, just in case we have any emergencies or any unforeseen um, issues occur. But for the most part, we have a schedule where we have some of the veterinary technicians in the laboratory downstairs processing samples that come in from the park. And we have veterinary technicians working together with the veterinarians in the clinical setting when we have animals scheduled to have routine exams and those type of things. We also have veterinary technicians going out into the park, into the zoo, into the different areas, and we can also provide some services in the park together with the veterinarians, and we do some exams and different things out in the park, and so that person is assigned to that. And then we have another area where a veterinary technician is assigned to the pharmacy. And so we're basically filling and dispensing any prescriptions that the vets will submit for treatment and preventative care for the animals.
Wow, so it sounds like you wear a lot of different hats and no 2 days are the same there. But it does sound like you do have a hand in all of the different parts of STEAM. You know, in science, you're obviously using animal anatomy and things and technology. I assume you're using X-ray machines and ultrasounds, and that's really neat. And I know that a lot of math must go into pharmacy prescriptions as well.
Yes,
So we
right.
actually have some pictures of some of you working. I was wondering maybe we could take a look at those and see, you can maybe describe what it is that's going on.
Okay, yeah.
Get that up on the screen. There we go. I think we have these pictures of you at work, which is so cool. Do you want to run through what's going on in some of these pictures?
Sure. So the first picture here on the left is a frog that is having a blood collection,
Wow.
and that's from the middle of the abdomen. There's a blood vessel there that we can access to collect a blood sample.
Wow.
The picture in the middle is an elephant shrew that is just waking up from anesthesia. And so you can see his eyes are closed there. He's wrapped in a towel because we manage the temperature regulation for these animals when they're recovering from anesthesia. And I'm just listening to his heart at that point, just making sure that he's doing well. Let's see, the picture on the top is a panda, giant panda exam. And so we have multiple team members in that picture. And I am performing another auscultation to get a heart rate and listen to the lung sounds.
Wow.
And then the picture on the bottom right is ultrasound. And so our veterinarians are primarily the people who perform the ultrasounds. And this is me retrieving the images and saving them to a jump drive.
Wow. What kind of things does an ultrasound show that you're looking for?
The ultrasound shows a lot more of the soft tissue type imaging. And so we can look at the kidneys, we can look at the uterus, we can look at ovaries, liver. We can even look at the blood vessels with a different, with a change of the tool. So, you know, it's a very useful diagnostic tool in showing more of what's going on within the soft tissues of the body.
Very cool. And so I know that in addition to ultrasounds, radiographs or x-rays is another big tool that you use in these exams. And I think the next slide actually has some examples of really cool radiographs that you've taken. So we have this radiograph or this x-ray up on the screen. What animal is this?
This is a prehensile-tailed porcupine.
Porcupine, okay.
Yes. And you can tell because of the large incisors, which are the big teeth in the front that rodents use to eat their food. And you can also tell, this picture particularly is pretty neat because you can see the spines, the quills of the porcupine all along the back, kind of off of the body where it looks like hair strokes. And those are the actual quills that show up when you take the radiographs.
That's so neat. And I actually think the next slide has even more talking about that diversity of animal species that you help treat. We can really see, you know, these radiographs are so different depending on what species we're working on. So those look very, very different. Do you want to talk about these ones real fast?
Yes, sure. So the first one here on the left, most people probably are guessing is a snake. And so this happens to be a smaller animal, so we were able to fit most of it in the film. But sometimes when you have larger animals that are, you know, 3, 4, 5 feet long, we will have to break up the imaging into sections of the animal. But you can see, you know, how many ribs a snake has, which is a lot. The photo in the middle is a horseshoe crab. And so that is just a really neat photo, x-ray. We do have some freshwater rays as well at the National Zoo that show up really nice on radiographs, but I wasn't able to find a photo or an image of that. The animal here on the right is a fish. And so you don't typically see very many x-rays of fish. And so I thought this would be neat to include, just so if anyone's wondering, you know, what different type of animals we work with. We pretty much work with everything that's in the National Zoo's collection. So every animal on site is an animal under veterinary care.
That is so cool. So you're treating things as big as our Asian elephants and as small as our fish in Amazonia. That's really incredible that you have that much knowledge of such diversity of taxa in the zoo. You want to talk a little bit about how you got into this career being a vet tech?
Sure, yeah. So I was very young, as most people are, when they find out what a veterinarian does. And I think I was chasing pigeons in the city, and my mom, you know, scolded me for doing that. And I asked her, I said, well, what is what is an animal doctor called? And she said, it's a veterinarian. And from that moment on, I thought, oh, that's what I want to do. And so throughout school, I was focusing on sciences and math and that type of thing because my mind was made up that I was going to become a veterinarian. And once I got into high school, I saw some opportunities to volunteer in different veterinary clinics. And I'm glad that I did, because that gave me a more accurate description as to what goes on in the veterinary practice and all the different roles that people play within the veterinary practice. And so, having that exposure really helped me to decide that I really enjoyed the nursing side of animal care, which is essentially what the veterinary technician's role is, to provide nursing type care. And I fell in love with it, and from there I thought, okay, this is where my heart is, and this is the direction I want to go.
That's really, really neat. What is the coolest project you think you've worked on in your career?
Oh, the coolest project that I've worked on has got to be a large crocodilian roundup that we did in Florida many years ago. Um, and it was really neat because it was a collaborative effort with the keeper staff and the veterinary team. Excuse me. And we were able to successfully collect blood samples on about 200 crocodilian species in one day. And what was really neat about that was that it went off without a hitch. And, there was no incident. When you're working with live, awake crocodilians, that's what you hope for. And it was great. It was great to see the collaboration between the different groups. It was great to work with the animals, and it was great to have a successful turnout.
That's amazing. I can't imagine what it was like to round up 200 crocodiles. What do you think was the biggest one? How many pounds?
Probably about 200. Yeah, we tried to keep it within a manageable weight group. Even though we had multiple teams working in different areas in order to accomplish that. So some of the larger guys, definitely weren't safe to handle or to interface with without any form of medical intervention. But any animal that was considered, within the safe zone to do so, those animals were the ones we contacted.
Do you want to talk a little bit about what classes or schooling and certifications you needed to get into this career?
Sure. Yeah. So my route was a bit unconventional. There is a traditional route. And so the traditional route usually involves attending an accredited veterinary technician program. Most of those programs, if not all of those programs, require that upon completion, you take the national exam to be boarded. And once you pass the exam, you will either receive a license to practice, a registration to practice, or a certification to practice, depending on state, is where the variance applies. And so after that, you're essentially, a veterinary technician. Beyond that, you can further your career in specializing if interested. And so you can specialize in zoo medicine. You can specialize in emergency medicine, in dentistry, in multiple different areas. And so the way I got here was actually through the human medicine route. And so I took that route initially and loved it. I loved working with people. I enjoyed human medicine very much, but I still missed that yearning or that calling, if you will, that I had as a youngster, where I just wanted to work with animals. And so, it just took a little bit of tweaking with my schooling path in order to make that transition. And then of course I took the board exams and became a licensed veterinary technician, and have been doing it for about 15 years now, a little over 15 years now.
That's really incredible. So I know that a common theme in especially zoo jobs is we often get these jobs and it comes with, as we call them, other duties as assigned.
Yes.
Things that you maybe didn't expect to be doing in this career. What are some of your other duties as assigned that you find yourself doing?
Yeah. And so, we are very lucky to have volunteers, and we welcome volunteers in all parts of the zoo. You see them kind of everywhere. And we're very fortunate to have them, because there are additional duties that need to be accomplished in a veterinary practice that sometimes you don't prioritize, because animal care, comes first. And so some of those things are things like laundry, equipment, engineering. If the washer is busted, you have to kind of tinkle with it and see if you can figure it out. There's data entry, there's, mopping the floors, janitorial type things. There's all sorts of other things going on, restocking supplies and that kind of thing. That all ties into the practice. But sometimes may not be, the top priority at the time. But, some people think that we're just snuggling cute animals all day long, and it's not so.
So you're not exempt from computer work and you're not exempt from laundry. That is very good to know. That's amazing. Do you have any advice that you would give a young person who is interested in becoming a vet tech?
Yeah, I would say, do the volunteering route, do the internships, do whatever is available to provide that exposure to the field. That gives you an opportunity to just immerse yourself in that surrounding, and that'll give you an idea of where you want to go. You'll either know right away which direction you'll want to go, or you'll know that you want to take a different direction. But I think it's important to have that exposure early on, so that you can better decide and choose the path that'll take you there.
That's great. So obviously you are aiding directly with all these animals and their health and their welfare. And all of our animals at the zoo, hundreds of different individuals and species here, they all have their own sort of conservation story and they all deserve attention. But what is your favorite conservation passion, the one that you care the most about?
So I actually really care about our oceans. And so that has been a huge passion of mine. And, the more awareness that is being raised about it, I think the more we're reaching folks about, the dangers with plastics and straws, disposable items, and that type of thing that ends up in our oceans. The world is something like 70% water, which is huge. And there's so much that is unexplored in the oceans, that we don't know still. And, I just think it's important to maintain the integrity of our oceans and all of its inhabitants. And, the zoo has even had a couple of events where, we raise awareness to the public as to what's being, fished out from these waters. And you'd be surprised about the amount of trash that is coming out of our oceans. And, some people are using that trash and creating amazing pieces of art out of it to raise awareness. And so for me, it's just reached home, and it's become a very passionate issue for me.
That's wonderful. Yes. Ocean conservation, reducing our single-use plastics. Absolutely. So we have so many great questions in the Q&A that we're going to get to, but I have one final question that I have to ask all of our guests on this webinar. So obviously you work with a ton of different species, as we talked about. What is your all-time favorite animal at the zoo and why?
So I don't really have one. I have a group.
Okay.
And so most people who know me know that I am predominantly a bird girl. I love birds, and reptiles are right in there with birds. They're essentially just featherless birds. There are a group of mammals that I also enjoy. The occasional otter or great apes have my heart. Squirrels, I know it's random, but that's just how it is. So the reason birds in general tug at my heartstrings is because for me personally, I find them to be more challenging when we're working with birds. And that could be because, physiologically they're a bit different than other particular species. And so I like working with the fact that, they have multiple air sacs that require them to exchange gases. It's really neat to also know that they have these bones called pneumatic bones that also help with gas exchange and play a role in flight and endurance and that type of thing. And then aside from that, I just think that they're really cool to look at and very smart. And, they look pretty prehistoric and, it's like a feathered dinosaur. And I just love them. I can't say enough about them.
Great, I know. And there's just so much diversity just within birds as well, from our flightless ones to those with flight and size differences. It's incredible. Well, thank you, Sosa. All right, let's get to some of these questions in the Q&A. I know you covered this at the very beginning, but can you just quickly go over again the difference between a vet tech or a veterinary technician and a veterinarian?
Yeah, so the veterinarian, to put it in maybe a comparison, the veterinarian you can think of as your family doctor. So the veterinarian is in charge of managing the health of the animals and formulating any preventative medicine options and treatment plans and that type of thing. So they're kind of in charge of the overall health and prevention of disease of the animals. The veterinary technicians, in comparison, would be like your nurse. The veterinary technician is there to provide support to the veterinarian and help the veterinarian carry out any treatment plans, and that type of thing, pretty much. And so, the veterinary technician and the veterinarian kind of have to be the jack of all trades. And so we dabble a little bit in everything. And so there are specialties like we mentioned before, but specifically, and we do utilize those resources at the zoo as well. But for the most part, we do dentistry, we do radiographs, we do surgery, sample collection, laboratory work, pharmaceutical stuff. And so it's just kind of all encompassing as far as, medical care is involved. And I would just say in comparison, just to give a reference, it would be similar to a human medicine doctor and a human medicine nurse, essentially.
That was a great comparison. I think that helps, yes. We have quite a few questions about specific animals that the vet techs at the zoo and you get to work with from. There's a rumor that this is where the baby panda is. Do you get to work with the big cats, the lions, and the tigers? You want to go into a little bit about that, whether there are specific vet techs for specific animals or you really get to work with all of them?
Yeah, so no, there isn't any limitation. We don't have any assignments to specific group of animals or anything like that. We basically, the veterinary team basically provides care to every animal in the zoo's collection. And so that could be, a tarantula all the way up to the elephant, basically, the way you had said earlier. And so any animal that is at the zoo is under veterinary care, essentially. And so we don't have any specific groups that work with specific animals. We do have favorites. Everybody has favorites or preferences, I should say. But no, we basically see them all.
That's really cool. And I did see a little bit of a mention in a chat that someone had hermit crabs. We did, I think we still do have hermit crabs in the park, and even our hermit crabs get veterinary care as well.
Yep, Think Tank has them.
Yes. So we have a question here. How many emergency procedures or emergencies does the hospital and the veterinary technicians get, would you say, a year?
There's really no number I can assign that. You know, it's very much just a random type of selection. You know, thankfully, I can say that we don't get many. You know, and that's largely in part to preventative medicine and just routine exams and just overall care and visualization of the animals. We do get, you know, a few here and there that are unpreventable situations, and even just random wildlife in the zoo that, you know, may or may not come up to the veterinary hospital for either treatment or you know, referral to another area. But there's no way to quantify that. It will be different according to circumstances.
Great. We have a question here. We saw that X-ray of the snake. There was a question if that was a king cobra. I imagine a king cobra would take a couple different radiographs to fit the entire thing on, right?
Yes. No, it was not a king cobra. Sorry to disappoint whoever asked that. It would be really cool if it was, but no, it was not.
Can you talk a little bit? There's a question here about how you work with venomous snakes, because we still provide care for those dangerous animals as well.
Yes, we do. And so, you know, there's protocols in place throughout the entire zoo, depending on what species we're working with. And that not only applies to the veterinary team, but it also applies to the animal care team on site. And so the area that houses venomous snakes have their own protocols and are considered the most experienced personnel when it comes to venomous. And so the veterinary team relies heavily on leadership from that area. And so when we are working with venomous snakes, we formulate a plan. We discuss that plan with the curator staff and the keeper staff. And then, you know, we come up with what is expected. And so we do have measures in place if there is exposure of some sort and what the steps are. We also run drills in the zoo to practice and make sure that everybody feels comfortable going through the process in case there is an actual snake bite. But we work very closely, and you know, that's a good question, because that's not just with venomous, but with other animals in the zoo that are considered a danger or a threat to human life. There is a very tight-knit collaboration with the veterinary team and the animal care staff. And there's always thorough discussions that are taking place before anything is done. And there's always a plan, you know, plan A, plan B, plan C. And sometimes, you know, it turns out that, you know, if it doesn't work out, if we're having kinks in the road or, you know, some type of roadblocks, then, you know, we can always reschedule.
Great. We have a few questions a little bit about, can you talk a little bit about the difference between when you would, you know, sedate or anesthetize an animal versus when you would not, and how those exams might differ between, say, an elephant or one of the larger, we'll say a bear, and maybe a smaller animal that doesn't need to be anesthetized?
Sure. So the difference between anesthesia is that the animal is fully immobilized and reliant on us, essentially, to be sure that, you know, we are regulating temperature, we are exchanging gases correctly, we are maintaining within normal ranges of heart rate and blood pressure and those type of things. an animal that is sedated is essentially an animal that is under some form of chemical influence. And so those are form of injectable drugs and different things. And that animal is basically still able to perform its own normal functions as far as like standing, still able to breathe on their own and that type of thing. Sedation is something that we don't typically use very often. We choose to use sedation with our elephants because that's the plan that the veterinary team and the animal care team have come up with. But most other animals that are having full exams will be under anesthesia. There are very limited animals that we do exams on without anesthesia, unless it's a large group of small animals that need, quick sample collection or something like that. So really it's dependent on the overall plan. It's dependent on what the veterinarians have decided would be a good approach with certain individuals and discussions with the animal care team.
Great. There is a question here about, well, first of all, are there any animals that you don't like? And do you still have to work with them even if you don't like them? The example thrown out was spiders and scorpions, but I know zoo professionals tend to have their own animals that aren't necessarily the norm that you would think of as unfavorable.
So personally, I don't have any animals that I, have any type of phobia or adverse reaction to. And so that wouldn't apply to me personally. However, I have worked with coworkers who do have aversions to particularly spiders or frogs or, just kind of random other things. The expectation, of course, is to provide a safe working environment for not only ourselves, but for the patients. And so, it's not that that we say you have to work on all animals, regardless of what your fear is or phobia. But we also are a pretty tight-knit family, and we can talk to each other and we understand what's going on. And so obviously the person who is deathly afraid of tarantulas is not going to be forced to, take a radiograph of a tarantula or anything like that. And so, and there's, plenty of other staff members that are willing to step in. So there's no expectation to, to overcome your fear or whatnot. If in fact you have one, we do respect each other's preferences or each other's phobias, and we try not to put someone in that situation.
That's great. So before we wrap up, we'll ask one more question. There is a question about the baby panda. What is the cutest baby animal that you've had the pleasure of working with at the zoo?
Oh, geez, you're putting me on the spot. So many. Okay, so I am a huge fan of the red pandas. A baby red panda is the cutest thing I've ever seen. They're just so scrappy, and this brings me to a good point because, everybody loves to talk about how cute these wild animals are, and especially when they're babies. But in fact, we need to remember that they are wild animals. And I'm not at all encouraging anyone to, approach any animal in the wild because they want to cuddle or give kisses or, that type of thing. So, be mindful that even though they're young, they're neonatal animals, they can still, defend themselves. And that's the purpose, that is the circle of life. These animals are born in the wild and they need to survive. And so the scrappier an animal is, the better survival rate. And so red panda babies tend to be pretty scrappy. And, obviously we consider that cute, but also that is a wonderful survival technique and highly encouraged. So obviously we want to try to minimize any human exposure to that extent. We still want these animals to pretty much function as they would in the wild.
Great. Well, thank you so much, Sosa, for joining us today for our wild side of STEAM. I personally learned so much, and it sounds like your job is so fascinating, and every day is different. And I'm sure our viewers learned a lot as well. Thank you again to everyone for joining us, and thank you to Sosa for the wonderful insight into your career being a veterinary technician at the National Zoo.
You're very welcome.
We hope you will join us for our next installment of The Wild Side of STEAM. That will be on Friday, December 4th, so mark your calendar. There we will get an insight into the A of STEAM, the arts, and we will be talking with the zoo's videographer. On behalf of the Smithsonian's National Zoo and Conservation Biology Institute, we hope you have a wild day. Bye.